North Dakota Governor Doug Burgum announcing 4 additional cases of coronavirus on this Tuesday afternoon, bringing the total number increase to 6. Here's Governor Burgum.
In terms of updates for today, North Dakota Department of Health confirmed 4 additional cases of the novel coronavirus disease, or COVID-19, 1 in Burleigh County, 1 in Dunn County, 2 in Cass County. As has been our practice, we're sharing gender and ages and whether they're community or travel. In Dunn County, a man in his 20s, travel related, woman in her 40s, Burleigh County, under investigation with our contact tracing team. And the same for the 2 from Cass County, one a man in his 70s, another man in his 90s. Both of those are under investigation. For totals, that brings us to 1,602 tested in North Dakota. That's up 162 from yesterday that are in the system. And again, positive +4 from yesterday. Hospitalizations, sadly, also up +3 from yesterday to 7 hospitalized. And we've received tests from 49 of 53 counties. And today we're adding a map to the health.nd.gov coronavirus site that shows tests from county. In terms of contact tracing, which we talked about, this is an area where here in North Dakota we're trying to really double down on. As we've said before, we're like to say we're well positioned and well prepared. We've got extra lead time because of the spread coming to North Dakota a little bit later. But as we've also said, we're not immune to that. We know that we're going to have more cases coming. We have to continue to work hard to do even a better job on the testing front to keep the testing growing. And then on contact tracing, again, we're not trying to find negatives, we're trying to find the positives. And when we find positives, we would then want to make sure that people who either are positive or who have people who have had contact with people who are positive, or people who have contact with people who are presumed positive, that we're doing a great job of those people isolating. And so we said yesterday we had added or increased up to 123 people that were doing contact tracing, 25 of those from the Department of Health staff, 98 from local public health, and 16 NDSU students that are coming online, public health students. And today we're in the process of adding 10 to 25 more nurses to that are being trained today. So again, the goal here with the more aggressive contact tracing to try to make sure we can isolate those folks that have the highest amount of risk. One best practice in this for individuals, again, if you are waiting for your test results to come back, and we know that there are many people that are in that category, the pending thing, or if you are close to someone who's waiting for the results to come back, you should be self-isolating. Another best practice would be if you've got any suspicion at all that you might be contacted in the future by one of our contact tracing teams, they will be asking you, who have you been in contact with? Most of us, go through a day, and if we go to the grocery store and we check out or we interact with people, we probably don't think anything of it. But again, would be really helpful as part of what you could do in terms of your own individual responsibility is even consider, keeping a small journal of people that you might have had contact with, because if you find yourself in the next 1 to 14 days being tested positive, or someone close to you test positive, you could help save lives by knowing and notifying public health who else that you may have had an interaction with.